Hello, my name is Josh Blair. I've chosen the sexually transmitted disease crabs. Crabs is an infection caused by parasites which live in the pubic region of the body. Crabs is medically known as pediculosis pubis, but is more commonly referred to as pubic lice. The reason for the term crabs is because under a microscope, the tiny lice have a crab-like shape and usually have 6 legs. The origins of pubic lice aren't completely known, but there are a few theories and clues as to where crabs might have come from. While sexual contact is the most responsible form of transmitting crabs, it is still believed that humans could have simply contracted the infection by sleeping in gorillas' nests. Lice in general have been a problem in Europe since at least biblical times. Many remedies, including viper broth, oil from hyssop, and tobacco juice, were said to have killed lice. Women even were said to have created ointments from ashes and bacon grease, which were then applied to infected areas. Lice have also been mentioned several times in the Bible, most often referring to the third plague sent on Egypt. In 2002, pubic louse eggs were found attached to the pubic hairs of a 2,000-year-old Chilean mummy. Adult lice were also found in sediment on clothing from a 1,000-year-old Peruvian mummy. It is believed that the lice found on these bodies must have been carried by those who migrated to the Americas. Pubic lice have been considered an epidemic in the United States since the 1960s. The sexual promiscuity and free love movement of the 1960s is one of the main causes of this epidemic, and without a doubt increased the transmission and spread of pubic lice. Crabs can easily be contracted just by coming into contact with someone who carries the disease. Their clothes, bedding, and toilet seat could be infected with pubic lice. Still, the most common way to contract the disease is through sex. A general myth about crabs is that a condom can prevent the spread of this disease. This means that crabs can be transmitted through any type of sex. The reason for this is that lice are attracted to moisture and use their legs to wrap around human hair. This implies that pubic lice can spread to any part of the body where there is hair. While pubic lice mainly live in the groin region of the body, they have also been found in the beard, chest, armpits, and arms, as well as around the face area. The only source of nutrition for lice is blood. The pubic louse is one of 500 species of sucking lice. Their mouths are designed to suck blood, hence their name. When crabs are transmitted through intimate interactions, the pubic louse can infect the hairs on someone's chest, eyebrows, eyelashes, face, or even their scalp. When an adult louse is transmitted from one carrier to someone without crabs, it can live for 6 weeks but will die within 24 hours without blood. Although within that time it is very likely that the adult louse could have already laid its eggs. This being because a female louse can lay between 2 to 3 eggs a day. Lice eggs are called nits. Adult lice can attach their nits to pubic hairs, and within 6 to 10 days, these eggs hatch into baby lice, which are known as nymphs. Within 15 days, these nymphs grow into adult lice, and the cycle of reproduction continues. Crabs often appear as dead skin flakes to the human eye, but can be seen under a microscope. These parasites travel a few inches a day and leave bites along the way, which tend to give the victim inflamed skin and small red or sometimes bluish irritations. Within 5 days of contracting an adult louse, these signs of crabs can lead to intense itchiness. The symptoms only get worse with the reproduction of the parasite, and scratching of inflamed or bitten skin only further irritates and worsens the infections. The main danger of this disease is that this further irritation can lead to blooding and scabbing of the skin in the pubic region. Some other symptoms of the disease include mild fever, irritability, and energy loss. It is also interesting to mention that when lice suck your blood, they no longer appear white, but instead darken and swell up with the blood that they sucked. Diagnosis of crabs can easily be determined by someone infected with it. Using a magnifying glass, you can easily determine the shape of a louse, and even some of the bigger ones can be spotted by the naked eye. If you think you have been exposed to pubic lice, you should immediately visit your doctor to decipher whether or not treatment is required. Thankfully, unlike some other sexually transmitted diseases, there's treatment for crabs, and it is possible to get rid of this infection. There are a number of over-the-counter prescription anti-parasite shampoos and creams which can be used to treat a louse infection. Another recommended tip to ensure that the infestation is fully killed off is to fully decontaminate your home. This means vacuuming your entire home and either dry cleaning all bedding, towels, and clothing, or even replacing these possibly infected fabrics. In conclusion, the only really sure way to minimize or prevent the chance of contracting crabs is to practice abstinence. If you'd like to know more on this topic, you can visit any of the following links listed in my works cited. Thank you for listening to my presentation. Are there any questions?